In the next few lessons, we are going to explain and demonstrate traction splints. So, why do we traction splint? What do traction splints accomplish? In this country, they're only used for midshaft femur fractures. Now, whenever you fracture a bone in a limb, the muscles tend to spasm and contract and self-splint the bone. But the problem with the femur is that the muscles around it are too strong, so they drive the broken bone ends into the soft tissue. You can lose enough blood to go into shock. What a traction splint does is gradually pull the broken bone ends apart and tamponade the blood vessels in the muscles to control the bleeding. Now, the first traction splint, and my assistant is going to hold up the original Thomas half-ring, developed by a Welsh orthopedist, Hugh Owen Thomas, in the 19th century, introduced to the French and British armies by his nephew, Sir Robert Jones, reduced the mortality from femur fractures from 80% to 20%. The ischial pad goes under the buttock crease, and the hair traction splint began as an ankle hitch and ratchet attachment for the Thomas half-ring. But we now use the hair traction splint itself. And my assistant will point to the ischial pad, which goes under the buttock crease. Then there is a strap which goes around the hip. At the other end, we have an ankle hitch, which usually you will want to put on first, so that your partner can then apply manual traction and lift the leg while you slide the traction splint underneath. Once you have the traction splint in place, you hook up the ratchet, which my assistant will show you, to the ankle hitch and crank up enough traction to do the job. The recommendation says about 15% of body weight, but the real criterion is when the patient stops screaming and says, "Ah, that feels so much better." Now, urban EMTs are unlikely to see midshaft femur fractures. More likely, they're going to see proximal or hip fractures, typically in elderly people with osteoporosis. But if you are an EMT in the back country, especially if you're a ski patroller, you are going to see mid-shaft femur fractures. Now, how would you tell whether a fracture was midshaft or proximal? With other bones in the body, you can actually press on the bone and elicit point tenderness. But the femur is wrapped in layers of muscle. So if you're not sure where it is, the criterion is if you apply a traction splint and it relieves pain, it's working. If you apply a traction splint and it makes it feel worse, then a traction splint is probably not appropriate.